quick to combat crime. Despite we pledge to win, St. Kitts and Nevis keep on rising. Oh, land of independence, land of peace and perseverance. 25 years of progress, 25 years of success.
Touching potentially contaminated surfaces of the mask. Discard the mask in a closed bin immediately after use.
We are doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat.
Is on.
Good day and welcome to our NEOC COVID-19 weekly briefing for Wednesday, the 8th day of September, 2021. I am Les Roy Williams. Thank you very much for joining us for our briefing today. I acknowledge among us the Honorable Wendy Phipps, the co-chair of the Disaster Mitigation Council. We continue to update you on what is happening in St. Kitts and Nevis in relation to the COVID-19 pandemic. We are united in this fight to bring about a safer and healthier St. Kitts and Nevis, and indeed, we are a part of what is happening in the world, with each person playing their part and making their circle, their little corner, healthier and safer by adhering to the health measures that have been put in place. Today first, I want to invite Superintendent Cromwell Henry, who is a member of the National COVID-19 Task Force, and he will bring us his usual update with respect to the adherence to the COVID-19 regulations. Superintendent.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever medium. New regulations have been published and will be effective until September 22nd. These new regulations are identical to the previous regulations, except for one critical and important provision. Since night curfews started in the Federation, we have seen an increase in the number of traffic accidents at night. Most of these accidents occur close to the curfew time. Significant injuries and damages were caused in these accidents, and in one instance, death. This increase in accidents suggests that persons are hurrying to get home ahead of the curfew without any regard for safety on the road. This despite our many pleadings for persons to leave whatever they're doing and for businesses to close in sufficient time so that you can get home ahead of the curfew. These new regulations, therefore, prescribe a specific time for the closure of businesses. Regulation 36B states, all businesses and enterprises shall operate in such a manner as to ensure that the closing hour shall be by midnight. That is, at least 1 hour before the start of the curfew, which is at 1:01 a.m. Of course, given the size and nature of the establishment, you may need to close even more than the hour ahead of the start of the curfew. The objective here is to ensure that your patrons and staff can safely get home before the curfew time, bearing in mind that some of those persons may have to rely on public transportation to get home. Regulation 36A states, all businesses and enterprises shall operate in such a manner as to ensure that the operating and closing hours allow sufficient time for all personnel to adhere to the hours set for curfew. Remember, the curfew and all the other measures in these regulations are intended to prevent and control the spread of the virus. We ask, therefore, that you see them as such and that you do your part to keep us all safe. Remember to wear your mask when in public, avoid crowds and crowded events, and practice good hygiene and sanitization behavior. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operating Committee Situation Report for today. Dr. Laws.
Thank you, Mr. Williams, and a warm good afternoon to everyone. This afternoon, it's my task to share with you the Health Emergency Operating Committee's Situation Report for Wednesday, September 8th. I'll begin by just underscoring the COVID-19 protective measures. Some may say I'm repetitive, but it's important because our numbers continue to rise. And based on the information we glean through contact tracing, we are realizing that persons are not buying into these COVID-19 protective measures. These measures can make a difference between yourself and you're becoming a statistic or becoming or contracting or picking up the virus. And so we want you to wear your face mask at all times, especially once you walk through your front door. Please keep on your face mask. We want you to maintain hand hygiene, maintain a safe distance between yourself and others when you're out in the public domain, and we want you to boost your own immune system. And if you are experiencing any of the COVID-19 like signs or symptoms, we want you to stay at home. This is very important. Again, when we interview the cases, you know what they're telling us? Oh, guess what? I was experiencing some, diarrhea or low-grade fever, or I lost my sense of taste or smell, but I still went to work, or I still went to church, or I still attended a funeral. Please, if you are not feeling well, if you are experiencing any of the COVID-like symptoms, please stay at home. Between Sunday and Monday of this week, we identified 49 cases of COVID-19, and on Tuesday evening, we reported 31 additional cases of COVID-19. And so at present, the Federation has reported a total of 1,310 confirmed cases of COVID-19, with 225 cases in Nevis and 1,085 cases in St. Kitts. At present, we are monitoring 566 active cases. So the team of case managers, St. Kitts and Nevis, they are monitoring 566 active cases, with 155 cases in Nevis, 411 active cases on St. Kitts. All right, so this is a summary slide. As I said before, total of 1,310 confirmed cases of COVID-19, with 225 reported on Nevis and 1,085 reported on St. Kitts. To date, 739 individuals who contracted this disease, they have recovered fully, and so that leaves 566 active cases. I want to pause and I want to ask all those cases who we are monitoring, you must remain connected to your case manager. If there is any change whatsoever in your health status, make sure to reach out to your case manager. In terms of hospitalizations, we have a total of 12 COVID-19 cases admitted. So in St. Kitts, on the COVID ward at the GNF General Hospital, 9 individuals are admitted, and at Alexandra Hospital in Nevis, we have 3 persons admitted. And to date, we've reported 5 COVID-19 related deaths. Now, as we said before, we are presently experiencing our 3rd wave of COVID-19 cases. So we had our 2nd wave. We identified our 2nd wave around about May 19th. That continued till about the 12th of July. And then starting round about the weekend of the 15th of August to present, we find ourselves in the 3rd wave. And so over this period, we've added 1,265 cases to our COVID-19 tally, with 694 recoveries and 5 COVID-19 related deaths. Now this shows the epi curve. So this shows the rise in cases between May and July, and then the 3rd wave, which started mid-August to present. I want to pause and again speak to the 1,310 active cases that we are monitoring. Each active case is assigned a case manager who makes contact with you on a daily basis. But we want you to remain connected with your case manager. So if perchance your condition changes or deteriorates, we want you to reach out to your case manager as soon as possible, such that you can be transferred to the emergency room and stabilized. So this is very, very important. And it's also important to boost your own immune system. Make sure you eat healthily in terms of fruits and vegetables. Maintain adequate hydration by consuming adequate amount of water. Make sure to rest. And also, please remember, even though you are asked to remain in place or isolate, we want you to still engage in some form of exercise. So you can exercise in place. And so that's very, very important. In terms of our COVID-19 response, the Ministry of Health, we continue our testing, COVID-19 testing, and that is testing of cases, their contacts. We conduct targeted testing and random testing. And so to date, we've processed well over 24,000 COVID-19 samples locally. The Ministry of Health, in terms of our public health interventions in response to the COVID-19 outbreak. We continue the contact tracing process, which is quite robust. And this process is guided by protocols. And so if you are diagnosed with COVID-19, you are automatically placed in isolation. So there is a stay-at-home order. Some persons are transferred from home to a government assigned isolation site. Now, if you are, as I said before, diagnosed with COVID and you are in isolation, you remain in isolation until you have recovered. And so if you are fully vaccinated, we have a few persons who are fully vaccinated being diagnosed with the disease. We find that your recovery period is shorter, so anywhere between 7 to 10 days we may assign you to be tested so that we can try and see if you have recovered. And so you are deemed recovered when we get 2 consecutive negatives. And so if you are fully vaccinated and you are diagnosed with COVID, the duration of your illness tends to be shorter, anywhere between 7 to 12 days before you get your recovery test. Now, if you're unvaccinated, most of our cases are unvaccinated, your recovery period is longer, and you will be in isolation for about 14 plus days. You will be tested, and then once we get 2 consecutive negatives, you will be deemed recovered and you will be officially released from isolation. Now, if you're a contact of a case and you are unvaccinated, you're automatically in self-quarantine for 14 days. You will get 2 tests, an initial test at the beginning of your quarantine period, and then you will get a second test at the end of your quarantine period, which is round about 14 days. Now, if you are fully vaccinated and you are deemed a contact of a case, we monitor you for 7 days. So that means you will be tested initially. Now, while you await that initial test result, we may ask you to stay at home. Once the initial test result returns negative, you will be allowed to work. We monitor you for 7 days, and then you will receive your second test approximately 7 days post your last contact with the COVID-19 case. So this is just a summary of the protocols that guides the contact tracing process. Now, when the public health team or the contact tracers interact with you or give you a call, we want you to be honest in providing the relevant information, and we are asking for full disclosure. As I said before, we continue our COVID-19 testing. As I said before, the cases, once you're diagnosed with COVID, you're placed in isolation. Once you are deemed a contact of a case, you're placed in quarantine. I mentioned the case managers. So all the cases, the 566 cases we are monitoring, they are case managers who are assigned, and they work they work around the clock to help facilitate speedy recovery. We continue our COVID-19 vaccination program. So these are the public health interventions being used to control the outbreak. In terms of our vaccination program, we continue the administration of the COVID-19 vaccines. At present, we are administering the Pfizer-BioNTech vaccine. We started the rollout on the 1st of September. So to date, we administered 46,463 COVID-19 doses, 21,914 persons are deemed fully vaccinated. So in other words, we've achieved a coverage of 74.3% of the target population receiving the first dose of the COVID-19 vaccine, and 66.3% of the target population receiving the second dose or being fully vaccinated. And this is an achievement in terms of a successful COVID-19 vaccination program. When you compare the Federation with neighboring OECS territories and the CARICOM member states, we are doing very well in terms of our COVID-19 vaccination campaign. Now, in terms of children, the Pfizer-BioNTech vaccine can be given, or we are administering it to children 12 to 17 years. We are also administering it to adults over 18. And so far, 2.5% of the children within the age band 12 to 17 years, they have come forward and received their first dose of the Pfizer-BioNTech vaccine. So this is a summary of our COVID-19 vaccination program to date. In terms of the vaccine, COVID-19 vaccine, it will be administered to pregnant females who submit a letter from their attending obstetrician and gynecologist granting clearance. So if you're pregnant and you've had this discussion with your OBGYN specialist, you can submit a letter granting clearance and you will receive the vaccine. The Pfizer-BioNTech vaccine received full US FDA approval for persons 16 years and over, and it has emergency use authorization for individuals 12 to 15 years. And so we have added this to the menu of COVID-19 vaccines locally. As I said before, we started the rollout on September the 1st. I want to underscore that this vaccine is safe and it's effective. Now, this vaccine, if you are interested in receiving the Pfizer-BioNTech vaccine, it's accessible at any of the 17 health centers in the Federation. So you just need to go to any of the health centers or call and make an appointment. This vaccine will be administered by appointment only. Now, we are targeting persons between the age of 12 years and above. So 12 to 17-year-old children and adults over 18 can access this vaccine. This vaccine is administered, the regimen involves 2 doses administered 21 days apart or 3 weeks apart. Ladies and gentlemen, we are engaged in a long war against COVID-19. We've been responding to COVID-19 from since January of last year. So it's near 18 to 20 months since we are responding to this pandemic. There is COVID fatigue, and some of us can speak to anger, denial, and all the other emotions, but we need to be patient in terms, and we need to endure, because it's through endurance that we will win this fight. And we need to use the tools that are available to us in terms of fighting a good fight. So what are these tools? The vaccine, the COVID-19 vaccine, is the best tool that we have in terms of fighting this fight. We want those who have not yet come on board to empower yourself with the latest information and do come on board and accept the vaccine. We have the Pfizer-BioNTech vaccine, and the Ministry of Health, the government, we are trying to get our hands on another batch of the AstraZeneca Oxford vaccine, because we are aware that there are a number of individuals who received their first dose. They have an appointment to come back in 12 weeks for their second dose. And so we are trying our very best to get another batch of the AstraZeneca Oxford vaccine. The wearing of the face mask provides significant protection against the virus. Maintaining adequate hand hygiene helps to protect you from the virus. Maintaining adequate distance between others when in the public domain is also another protective measure. And if you are experiencing any of the COVID-like symptoms, we are asking you to stay at home. And so school is open, so I'm pleading to parents of children, if your child is experiencing any of the COVID-19 symptoms, please keep your child at home. Do not send your child to school to expose your child to other students. So what are the common COVID-like symptoms? Okay, so we've interviewed all the cases that we've diagnosed, and these are the common COVID-19-like symptoms as reported by our also well reported. Most of our cases complain of joint pains. Some have a dry cough, and a significant number of individuals complain of watery stool diarrhea. Some complain of coughing and congestion, nasal stuffiness, body aches, and low-grade fever. So these are the common COVID-19-like symptoms that you need to be aware of. So if you're experiencing any of these, please stay at home. Do not go to work. If you have a child under your care and the child is experiencing any of these signs and symptoms, please keep your child at home. Do not send your child to school if he or she is experiencing any of these signs and symptoms. Thank you.
Thank you very much, Dr. Laws. I now invite the chair of the National COVID-19 Task Force and the National Disaster Coordinator at NEMA, Mr. Abdias Samuel, to give us his presentation.
Hi. Good afternoon, and thank you, Mr. Williams, to all who are watching via all the means available, and also listening via radio. Unfortunately, I would have had some images that I would have liked to have shared with you. Yes, we will upload them later on to explain what is going to happen at the Port Zante area in terms of the barricade that will go up to create the bubble and support the bubble. So as we have been hearing over the airways and also through the announcements being made by the St. Kitts Tourism Authority, that the Celebrity Equinox cruise ship will be arriving in St. Kitts on the 14th of September 2021. It is expected that persons who are going to be operating within this bubble should be fully vaccinated individuals, and they would have gone through the travel approved SEAL training, which was conducted by the St. Kitts Tourism Authority in collaboration with the Ministry of Health. The National COVID-19 Task Force would have carried out a number of inspections and walkthrough in this Port Zante area, and a number of recommendations would have been made for the vendors or service providers within the Port Zante area. It is expected that individuals who are going to be providing services within these areas will comply with and adhere to the COVID-19 protocols. We are satisfied that most of the service providers do understand what is expected of them, as there is limited or no room for errors. So the incoming international tourists on that day will be provided with tours such as the scenic tour of St. Kitts, There will also be a number of catamaran cruises to areas such as Shitten Bay on Frigate Bay, as well as a catamaran cruise that will also go to Nevis. Equally so, there will be a number of other tours to areas like Fairview Inn, Brimstone Hill, and also Caribel Batik, amongst many others. This is important information for you, the general public. What we are trying to do is have that that balance, that equilibrium of economic activity, as well as safeguarding your health. So the proposed barricade would begin on the on the western side, basically, from the Chop Shop area, and will run north towards the King's Pavilion, I think you call it, or the restaurant in that area, and then it would encircle where we know a Rock restaurant is, and it will come again against the steps there by these buildings. It would have been better for you to be able to see it on the image. This is the proposed fencing. And then this fencing basically will also see that behind by the Pelican Mall, there will be a barricade where the tourists will not be able to come down into that area. So the Amina Market and the Pelican Mall area are areas for discussions still. Then the barricade will continue on the eastern side from the buildings of where the First Jewelry, I think that's the name, Henry? First Class Jewelry, thank you. First Class Jewelry area, and we'll go south towards the pier. There will be a number of checkpoints that are still being looked at by the security forces, and these checkpoints will also be manned by a number of our security forces, a joint security forces team. There will be access to individuals. So, well, questions are being asked about individuals who do have workspaces there. We have created particular corridors for those individuals to be able to access your workspaces without having to interact with any international tourists or limit the interaction with any international tourist. And we are appealing to everyone that you must have the travel approved seal for you to be able to operate on that day. So everyone who is going to be within the bubbles, you must have the travel approved seal, and it must be visible. So when the compliance team, security forces come around and they expect that they can see this travel approved seal. The tourists as well, the international tourists, I'm advised, have been also being informed that wherever you see this particular seal, it means that it is safe for you to do business here. So I'm asking the merchant service providers who we have met with over and over to please display your travel approved seal. So how do you obtain the travel approved seal? You would have gone through the training with the St. Kitts Tourism Authority and the Ministry of Health, and upon completion of the training and being fully vaccinated, and an inspection being done on your property or your business place, whereby the markings are there, the mask, the enforcement of mask wearing, signs indicating the protocols are appropriately displayed. Then after all of that is done, you will then receive the travel approved seal once you pass this inspection as well. So that vigorous process is being done to ensure that we maximize on safety and security. So I am appealing to the general public at this time to conform with what we are trying to do. It's a gradual process that we are going to take to get there, and we need your cooperation during this time. So please do not give the security forces undue stress or challenges as we attempt to balance the risk with the economic activities. Ladies and gentlemen, on Monday, some schools would have opened, but today, the majority of the schools would have opened today. We want to encourage you to continue to work with the Ministry of Education, Ministry of Health, Security Forces, the National COVID-19 Task Force, on all stakeholders to ensure we safeguard the children of this federation. Please familiarize yourself with the guidelines for the reopening of early childhood centers, primary schools, and secondary schools, as well as AVIC and others. This document has been circulating all about, and you can actually reach out to the Ministry of Education to familiarize yourself with this document, with the protocols for the reopening of school. It's very important. It's a very comprehensive document that was created. And I want to end my presentation today by highlighting and sending out greetings, celebratory greetings, to Mr. Athel Cuthbert Rollins, OBE, and Mistress Patricia Eugenia Rollins, who are celebrating 50 years of marriage. 50 years, 50 years of marriage, and I think this is a great example to follow. So to Mr. Athel Rollins and Mistress Patricia Rollins, we want to wish you all the best and attaining such a milestone of being married for 50 years. I see Dr. Wilkinson smiling because he's going to reach it next. So thank you very much, Mr. Williams, and all the best.
Thank you very much, Mr. Samuel, for your presentation. We now come to the question and answer segment of the briefing. And I will start the ball off by this first question that welcomes Dr. Wilkinson back. And the question is, there is growing concerns about the tardiness in the publishing of the dashboards with the vaccination and COVID-19 status. We grew accustomed to hearing the updated information at the briefings or before 6 on non-briefing days. What is the reason for the protracted delays? Dr. Wilkinson.
Thank you very much, Lazoi, and it's a good question because concerns have been raised regarding the supposed tardiness of the dashboard. We have two dashboards, one that displays the vaccination status and the other for the positive cases, deaths, etc. Now, as it relates to the vaccination dashboard, as we have moved forward over the last 18 months, and when we started our vaccination program on the 22nd of February, I think it is, the vaccination program has expanded, and we have to collect information from 11 health centers across St. Kitts and 6 in Nevis. The results are, the information is tabulated at the Newtown Health Center and it's sent to the CMO's office for verification before it goes off on the dashboards. When the health centers close at 5, there is a lot more work involved in getting the information together. Previously, we would have had the information for you, for example, on the vaccination status at a briefing like this. But while the CMO was presenting, we got the information. And this comes once you have an increased volume of work. And so persons will be seeing the vaccination dashboard coming out later this evening. As it relates to the one that displays the positive cases, again, as we move through our third wave of infection, there's a greater volume of testing that has to be done. For example, yesterday we had 30 plus positive cases. And so with the contact tracing that had to be done today, one case might have 20, 30 contacts. And so you can see the volume of testing that has to be done on a daily basis. When the results go, when the information goes to the lab, from the time the test goes on the machine, it takes 3+ hours before it comes off, and they are run in batches. So we may, at 6 o'clock, get back results that might just show 3 or 4 or 5 positive cases. But when the final batches are released, sometimes we get the information back at 10, 11 o'clock, and you might have 20-something positive cases there. Now, if we were to put out that information at 6 o'clock, it will misrepresent what the real situation is. And so we believe in waiting until we get all the results back for the testing that was done in the 24-hour period so that we can reflect the true number of positive cases that we got during that time. And so there are going to be times when, depending on the volume of testing that was done, we might get the results back at 8, 9, 10, 11 o'clock. And because of the work that has to be done after we get the results in terms of verifying them, making sure that a positive is not just somebody who is being retested, showing that they have remained positive and they haven't recovered. The dashboard might not be ready right away. For example, yesterday's dashboard, I think, came out this morning because we got back the final results at about 11:30 last night, and there was a lot of work that had to be done to compile the information. And so there is no attempt to hide information at all. We have been coming forward with the information to you on a regular basis, and we'll continue to do that to make sure that we keep you informed and updated. Now, there have also been calls to modify the dashboard and present more information on it in terms of hospitalizations, etc. And we are looking into that so that we can keep you updated and informed so you can look at the dashboard and get significant information at a glance. I thank you, Leslie.
Dr. Wilkinson, this next one is for you, so don't go too far. Dr. Wilkinson, you were accused, without your name being directly called, of asking to stop the count by a former CMO. This was based on a post you made on social media over a week ago. If that is correct, why would you want to stop the count?
Let me start by saying that this is not going to be the only crisis that this country will face. But right now we are facing a major crisis, one that no one alive has faced before, and is the greatest crisis that the world has faced in the last 100 years. I also will not be always the medical chief of staff, and at some point in time I will be the former medical chief of staff. But what I want to assure the public is that whether I am the current or the former medical chief of staff, if there is any crisis that this country is facing, I will always be there to support the efforts of the Ministry of Health and those who are involved, because I believe that everyone needs to have a hand on deck, and there should be no attempt to undermine the efforts of what persons are doing. With that said, I'm going to use my time here to again encourage persons to come forward and be vaccinated. We are on the eve of opening schools. I want to encourage all the teachers out there, and by extension, all the essential workers, to make sure that you go forward and get vaccinated. I want to encourage the parents who are there to come forward and get vaccinated, and to bring your 12 to 17-year-olds out to get vaccinated. So I'm not going to focus on anything that any former person would have said. We are in a fight against a deadly virus, and we need to focus on getting as many persons as possible vaccinated so that we can move forward. Thank you.
The third question, can you give us any information on the last COVID death, which was number 5? Also, there have been talk on social media of a 6th death in Nevis. Can you shed some light on this?
Again, we want to let all the families who are suffering because of the loss of loved ones, let them know that our thoughts and prayers are with them. As it relates to death number 5, this was a gentleman, I think he was 96 years old, in a nursing care facility. Of course, he was not vaccinated now because he could not be, based on his health status. But this brings home the point that we make all the time. Those persons who can be vaccinated, they need to move forward and get vaccinated so that we can protect the elderly and the frail among us. And so with the increasing number of cases that we're seeing with this current wave, once you have increased cases, you're going to have more hospitalizations and you may have more deaths. And the way we're going to decrease that is by all of us playing our part and making sure that we adopt the non-pharmaceutical measures in our everyday life. And one cannot become complacent. We need to continue to do these. And all those persons who can be vaccinated need to move forward and get vaccinated. Yes, there has been talk about a 6th person who died in Nevis. There was a sudden death in Nevis, and this is under investigation. I believe that the police is looking at it. There should be an autopsy, and we await that information before we can tell you anything further on that. But again, we just can't be, on the one hand, getting alarmed when we see the numbers rising, but on the other hand, refusing to wear masks, refusing to avoid crowds and social distance, and refusing to go forward and get vaccinated. We are the ones now who can control the numbers, and you can control the numbers by doing what you know will work to decrease viral transmission.
Thank you, Dr. Wilkinson. This next question is from SKN Newsline. Some persons have raised concerns that CPL spectators, it seems, are not wearing masks or abiding by the usual COVID-19 guidelines. Is there an exception granted to fans as it relates to these measures?
The simple answer is no. There is no exception granted to anyone with regards to complying with the COVID-19 prevention measures, the basic non-pharmaceutical measures. But we see the same behavior anywhere in town. You go to the ferry terminal, you go on the strip, and you see this nonchalant attitude of persons towards the control measures. Persons are not wearing their masks, there's close proximity to each other, and they're basically ignoring all the protocols. We continue to admonish persons to take their health serious and that of others around them, to always observe the protocols, wear your mask, maintain physical distance, and always practice good hygiene, hand hygiene practices.
Another question from SK Newsline. Have there been any reports of adverse reactions to the COVID-19 vaccine, as we have received credible reports from persons who have experienced several conditions, including blood clots?
There is an adverse reporting form that we have, and anyone who got vaccinated, they can report any side effects, etc., that they may have experienced. And I can tell you that the Office of the Chief Medical Officer, we have not received any information regarding any significant side effects from the vaccines. It's important for us to know, though, that we have said before, blood clots are common, and so persons were getting blood clots even before the vaccines were available. And just because you got the vaccine, but if you have a predisposition to developing a blood clot, whether you are sedentary, you traveled for 6 hours on a plane, you are taking oral contraceptive pills, you might be pregnant, etc., that would not mean that you would not still go on to develop a blood clot. Okay, but we don't have any information about any major side effects.
I want to use this opportunity to say to anyone who received either the AstraZeneca Oxford vaccine or the Pfizer-BioNTech vaccine, if you are experiencing any adverse effects, make sure to report it to the health center where you received the vaccine. You can also call 311 and provide us that information, or you can call your physician, your regular physician, to provide us this information. So if you received either the AstraZeneca Oxford vaccine or the Pfizer-BioNTech vaccine, and if you are experiencing any significant adverse effects, make sure to provide us within the Ministry of Health that information. Call your nearest health center, provide us the information through the 311 or even through your regular attending physician. Thank you.
Thank you. And the next question, the last one from SKN Newsline. Lastly, some persons have expressed concern of public officials interacting with members of the public without wearing face masks or abiding by other COVID-19 protocols. Can the task force reassure that those in authority will follow the COVID-19 rules as prescribed, setting an example for the general public? Abdias.
Williams, thank you very much for the question. And I just want to give the reassurance that in the regulations, there is no exemption for anyone. So everyone is expected to be responsible in adhering to the protocols. And we will continue to encourage everyone at all levels of our society to follow and adhere to the protocols as outlined by the regulations. Thank you.
Thank you, Mr. Samuel. These two questions are from WinFM. Does the government plan to set up a temporary COVID testing and hospitalization site so that hospitals do not become overwhelmed? And the second one, are the specialized Cuban nurses still in the Federation?
We have said here several times before that we identified the private ward as the place where we would house the COVID-19 patients. We have at least 15 beds there. We also said that we had a contingency plan in place such that if the cases rise, we would command more of the hospital. This is what is being done in other countries, and if it comes to a situation where the cases become overwhelming, there are a number of things that we can do. For example, put a halt on elective surgeries, elective surgical procedures, etc. Okay, we, however, need to realize that we can control all of this. The solution is in our hands by persons taking personal responsibility of doing what they can to decrease viral transmission, by persons doing what they can to make sure that they can prevent themselves from becoming severely ill and hospitalized, and this is through vaccination. Yes, we've done a great job so far with the vaccination program, having at least 74% of adults with one shot and 66% of adults who are fully vaccinated. Yes, I'm happy to see that the thermometer with the 12 to 17-year-olds is now increased. I think we're at 2.5% as of yesterday. I want to see that continue to rise. And the way we are going to prevent us having to go to a place where we have to build a COVID-19 hospital, spending millions of dollars, is by you coming forward and taking the vaccination that is free and that is guaranteed to decrease severe disease and help to prevent you from going into the hospital or even give you the best shot at life. you're going to handle the second.
Okay. I was just nudged to just share some information with you. Again, we have 2 45-bed field hospitals that will be arriving in the Federation no later than next week. These field hospitals would be part of our contingency plan to be able to have more space to deal with any overwhelming of our hospitals in St. Kitts and Nevis. So that is part of our contingency plan to deal with any overwhelming situation. Thank you.
Thank you. It has been recognized that the fully vaxxed number is rising. However, only the Pfizer vaccine is being administered. Are persons getting a second jab of Pfizer after a first dose of the AstraZeneca?
Okay, so Mr. Williams, as I said in my presentation, we are presently administering the Pfizer-BioNTech vaccine. It has a 2-dose regimen, 2 doses given 21 days or 3 weeks apart. We have enough to give first and second doses. Now, there are a number of individuals who received their first dose of the AstraZeneca Oxford vaccine. They have 10-week appointments, and we are in the process of procuring additional AstraZeneca Oxford vaccines to provide the second dose for such individuals. So at present, we are not adopting a mix and match regimen in terms of the administration of the COVID-19 vaccine. Yeah, okay. Oh, okay. Yeah, so we do have a number of individuals coming forward for their second dose of the Pfizer-BioNTech vaccine because they traveled to the United States, Europe, and they received their first dose of the Pfizer-BioNTech vaccine in another jurisdiction. And so they are coming forward and receiving their second dose in country. Yes?
This next question is asking, what are the plans for entertainers and entertainment?
I will leave that question for the minister when she's here next. My plan right now is to focus on containing the wave of infection that we have, and so I ask you again to go out and get vaccinated.
Thank you, Dr. Wilkinson. Is the NEOC considering accepting rapid antigen tests for incoming air passengers as well? And the second one, are we on track to reopen the country fully on October 1st? And if so, what differences in protocols will there be?
We still have at the core of our testing the gold standard PCR test. We have said, though, that we are looking at the science behind the rapid antigen test, which is completely separate to the rapid antibody test that the former Minister of Health, Wendy Phipps, said quite categorically about a year ago that we will not be using. I don't think any country is actually using that as a diagnostic test right now, okay? And so one must make sure that when we're speaking about rapid tests, we know that there's a big difference between the rapid antibody test and the rapid antigen test. We're still looking at the sensitivity and the specificity as it pertains to the rapid antigen test, and as the science evolves and the sensitivity and the specificity increases, there might come a point in time when we might be using them, for example, in the school setting to do a rapid test on persons to see if they're negative or positive. But right now, the only test that we're using is the PCR test, the gold standard.
Okay. Mr. Williams, the second part of the question, or the second question, was about reopening on the 1st of October, correct? All right, so it's clear for us to understand what do we really mean by reopening. I think that the country was reopened last year, October, was it? 31st of October. So the country was reopened. If we are saying the further easing of the restrictions that were announced for, well, that was proposed for the 1st of October, first, let's concentrate on supporting the health measures, right? The Ministry of Health in helping to curb this particular wave. Nothing is written in stones. We know we see the dynamism of this particular pandemic. We can actually plan for one date, and things happen that we may have to change this date. So at the present moment, I think we are still monitoring, and then we will get back to you, the general public, as per the decision of the federal cabinet, whether we proceed with October 1st or we may have to delay the easing of the restrictions to bring back a greater sense of normalcy.
Just one more question from WinFM. It was mentioned a few weeks ago that samples were sent to CARPHA for genomic sequencing. Are there any results as yet?
The Caribbean Public Health Agency has acknowledged receipt of the 17 samples, and we are still awaiting the results of the genomic sequencing process. So as soon as we have this information, we will share with you, the general public, as we have done so in terms of when we receive the results about the Lambda variant in circulation. So as soon as we receive the results from CARPHA, we will share with the general public. Thank you.
Mothers who are employed at the industrial park leave home pretty early before their children are awake. Are there any checks that can be suggested to aid mothers to identify if their children may have contracted COVID-19?
All right, so if a mom is leaving home early, I'm sure that child is left in the care of an adult. And so when the child wakes up, that individual would have the responsibility to ensure that the child is normal and that the child is not experiencing any of the signs and symptoms I mentioned. And so no vomiting, no diarrhea, no fever, no coughing. So a child should always be under the charge of a guardian or an adult in the home who would have the responsibility to interact with that child and make sure that that child is not experiencing any of the COVID-like symptoms that I mentioned. And they're very simple. Okay, so vomiting, you look for vomiting, diarrhea, coughing, stuffiness, runny nose, fever, a change in appetite, because if there is an alteration of the sense of taste or smell, that affects your appetite. So these are the things you look for in children to see if the child is okay, normal, or if there is a change, or if the child is experiencing any of these symptoms.
Thank you, Dr. Laws. We'll have one more question after this, as we have to bring this press briefing to a close. Can someone explain, again, what is the science saying about the viral load of someone who is fully vaccinated but becomes infected when compared to someone who is not vaccinated and becomes infected?
Now, we need to understand that the vaccine gives you some protection. However, even if you're vaccinated, you may get infected, but you may be asymptomatic. The chance of you having severe disease and being hospitalized or dying from the disease is significantly reduced. When you are infected, you can become infectious, which means that you will have viral particles or virus multiplying in your nostrils, and you can infect someone. The viral load, however, is significantly lower than someone who is unvaccinated. And the period of time during which you are infectious, that is significantly reduced. And so most of the science is showing that after about 5 days, you would have cleared the virus from your system. And that's one of the reasons too why the CMO mentioned the different protocols in terms of quarantine and isolation in someone who was vaccinated compared to someone who was not vaccinated. And so despite the fact that we know that you may still catch the virus if you're vaccinated, the benefits from being vaccinated far outweigh you becoming sick and not being vaccinated. So I urge everyone, don't focus on what you're hearing about. Yes, you may still get infected. The important thing is that if you're vaccinated, you're more likely to have asymptomatic disease, and you'll certainly have a lower risk of becoming severely ill, being hospitalized, or dying from the disease. And the majority of persons, more than 80-something%, almost 90% of the infections that we are seeing now, these are in persons who are unvaccinated. So the science has shown that the vaccine works, the vaccine protects you from severe disease and death.
In a public address issued by Minister of Education, Mr. John L. Powell, in late August, he indicated that COVID-19 related protocols for schools will be revised for the new school year. Given that some schools have reopened on St. Kitts, have any adjustments been made to those protocols?
Mr. Williams, wonderful question. Earlier, I would have spoken to the dynamism of this particular pandemic with COVID-19. So we continue to revise these protocols on a regular basis. These protocols were developed last year, and the Ministry of Education, with their own internal task force that they have, continue to revise these protocols. We then take a look at these protocols in a wholesome way, and we advise them accordingly. So it's an ongoing process that don't stop. We always continue to revise and monitor these protocols amongst many other protocols that are brought to the National COVID-19 Task Force and the Ministry of Health.
And our last question, which is a sort of a light one. If someone comes into St. Kitts on American Airlines to collect a child and goes right back out, what is the process? Is there a quarantine process? So this person is a turnaround passenger who takes the next flight out without leaving the airport.
Okay. Yes, Mr. Williams, thank you for the question. We have facilitated this particular request over and over. What we will encourage persons to do is to write to the Immigration Department here in St. Kitts and Nevis of their intention. These individuals, the Immigration will then contact the Port Health, the Ministry of Health, and the other stakeholders such as Customs and the airline agency. Once all of that is done, the persons will be processed, and then accommodation will be made for the child to meet up with the parents or guardian, whoever the person may be, within the waiting lounge, and then they will be facilitated to board the aircraft. So these individuals will not be in a quarantine because they're not staying in St. Kitts and Nevis overnight. However, I want to encourage persons who are thinking about doing such an exercise to come prepared to quarantine for one night or a week, whatever it may be, in the event that something goes wrong. So even though you're planning it, come prepared to be able to go into quarantine if the need requires it.
Thank you very much, Mr. Samuel. That brings us to the end of our question and answer segment. I want to thank all of you for availing yourselves to answer these questions, which are all a part of the management of the COVID-19 pandemic here in the Federation. So thank you very much for answering the questions, and we continue to welcome your questions because we want you to be as well informed as you can be so that you can know how to manage yourself. And that is why we're here for that purpose. I want to thank Superintendent Cromwell Henry for his presentation, our Chief Medical Officer, Dr. Hazel Laws, Mr. Abdias Samuel, the Chair of the COVID-19 Task Force. We thank Mrs. Christmas Jacobs for her faithful service of sign language. We thank Dr. Cameron Wilkinson and we welcome him back. Of course, he has been in this for a very, very long time, committed to this cause. And we thank the Honorable Wendy Phipps for her continued support here at the NEOC. We also thank all the media houses, ZIZ playing a very main role here at the NEOC in bringing these briefings live on television and radio and streaming them on social media. We also thank all the other media houses in the Federation as your work in helping us with disseminating the information with respect to the pandemic is extremely important. We have to rely on information that is accurate, information that is credible, information that is up to date, because we know that there has been a big misinformation and disinformation campaign. But how do we deal with that? We counter that with information that is accurate and pertinent. Thank you to all of you for joining us. You are important to us. The role that you play helps us in managing the pandemic. We are all in this together. Until next Wednesday, take good care. Adhere to the protocols. Remember that the protocols, they're not just to be adhered to in the daytime and in the nighttime protocols gone through the door. They're to be adhered to in the night as well. And so That is how we will manage together and be safe and healthy together. Thank you very much. I am Les Roy Williams.